Dr. Megan Evans joins us now to talk about reproductive health care and patient advocacy. Good morning, doctor.
Good morning.
So you're working with Title X. You're really focused on that. Explain to us what it is and where it stands now.
Sure. So I am an academic generalist. Half of my week I spend at a community health center. And that community health center is a Title X grantee. So Title X is a federal grant program. It's the only federal grant program that focuses solely on women's reproductive health care. So contraception, sexually transmitted infection screening, as well as health maintenance screening. It serves about 4 million women a year, and it really focuses on women who are low income, don't always have the insurance coverage that they need for those services. So with Title X, it's been around since the 70s, actually started with the Nixon administration. This past summer, the Trump administration put forth new regulations that would essentially bar providers like myself from offering the full range of reproductive health counseling. So I would not be able to, as a Title X recipient, counsel my patients about abortion access if that's what they were interested in doing. And it was kind of dubbed a gag rule because providers would not be able to refer patients and counsel them on those options. There was an unprecedented response from the public, not only from women's health providers, but from patients from all over. And there was an open comment period during that time on Title X. I know ACOG had an overwhelming response from its members against the new regulations. We thought that the new regulations would go into effect in September, but they didn't. And we didn't really hear from the Trump administration until February. And so in February, they put forth the new regulations, really had no changes after this past summer. And immediately, the American Medical Association, Planned Parenthood, other family planning organizations, as well as 23 attorney generals filed suit against the Trump administration for these Title X changes. Fortunately, the rules were going to go into effect May 5th. 3 federal judges all came to the same conclusion that this was not appropriate for patient care, it was unethical, and have all temporarily blocked it. And ACOG actually filed briefs in all of those situations. One case in particular, the judge used direct quotes from the ACOG briefing, and a lot of that information came from our ACOG members. Stories from patient care, kind of their support of Title X, why it's so important. And so now we're just waiting for the litigation process to proceed.
Right, so there have been things happening in some states, Ohio, Alabama, Georgia. Does this affect healthcare overall, or is this still again with the abortion issue?
So it's primarily about abortion. I think since we've seen a shift in Supreme Court and who is now sitting on the Supreme Court, we've seen an unprecedented amount of anti-abortion legislation across the country. And we're seeing these really in 4 forms of what we call abortion bans. So one is a trigger ban. So essentially a trigger ban would be that if Roe v. Wade were to be overturned at the Supreme Court level, in some states, abortion would immediately become illegal in those states. We're seeing method bans, so bans in which certain types of procedures are being banned, or that's the proposition with the bill. Reason bans is another one, so for sex, race, disability, if there's a chromosomal abnormality, those type of bans. And then gestational age limits, so limiting abortion or decreasing access for abortion after 6 weeks, 18 weeks, and 20 weeks. And those states that you had mentioned all have 6-week abortion bans. So essentially proposing that a woman would not be able to seek an abortion after that 6-week mark, which most women actually don't even know they're pregnant at 6 weeks. Now, all of these, especially the gestational age bans, are unconstitutional, so will be challenged, tied up in court. But I think that the potential is that some of these cases could go through the court system, potentially end up at the Supreme Court level.
So what can ACOG members do if they want to have their voices heard?
We really believe that advocacy happens every day. It doesn't have to be getting on a plane flying to Washington, D.C. We're really seeing kind of the most egregious attacks on women's health as well as the most progressive at the state level. And that's where we really need our members' voices to be heard, whether it's talking to their colleagues, talking to their patients, getting active on social media, or volunteering to testify at the state level. ACOG members are the experts in our field. We are on the front lines with our patients and supporting women's health, and our voices need to be heard, and we really need to make sure that these kind of dangerous laws don't go into effect.
All right, Dr. Evans, thank you so much for joining us.
Yeah, thank you so much.
ACOG TV has all the coverage you want with the big events and key newsmakers. Be sure to check out our content, which is updated each day here on YouTube from the ACOG 2019 meeting here in Nashville.